afternoon. Good afternoon. Good afternoon to everybody, and thank you for tuning in today at 1 o'clock. I will begin, as I always do, by thanking you for everything you're doing and continually urging you to tune in right here every day, 1 o'clock, to get the best, most accurate information about the COVID virus here in Rhode Island. It's my hope that after the end of these, you take a bit of a breath and a sigh of relief. I can't sugarcoat it, but you should at least have confidence that we're on top of it. We're doing better than a lot of other states, and we have a team working 24/7 to keep you safe. A quick announcement. Tomorrow, this press conference will happen at 2:30 instead of at 1 o'clock. I have a call at 1 o'clock with all of the other governors. So tomorrow, 2:30, and then back to 1 o'clock for every other day. I'm very sad to say today to report another 4 deaths on account of the coronavirus, bringing us to a total of 8 deaths here in Rhode Island. We have 86 new cases, bringing us to a total of 488 cases. And the most important number that I'm looking at, we have jumped to 59 people in the hospital. By any measure, going from 41 to 59 people in the hospital in one night is a significant and serious jump. It's one that we have our eye on. It's not surprising. It's not alarming. But you should know we're in a rapid spread phase of this disease, and this is going to get much harder before it gets easier. So it's what we've been planning for. It's why right now we are readying facilities all around the state for another couple thousand hospital beds. We are securing ventilators and PPE. We are calling up extra doctors and nurses. We're working with the hospitals on their surge plans. I can't stop that. This is going to happen. What I can tell you is that we're going to be ready as we can, and we clearly have community spread, and we're in a rapid spread phase of the virus. So if you're wondering what you can do, what are you supposed to be doing? You're supposed to be buckling down like you never have before. You're supposed to be listening to the directions that I provide and the Department of Health provides, and you're supposed to be not pushing the limits of these social distancing and mitigation guidelines or orders that we're providing you. You're supposed to be taking what we give you and doing that or more so. I want to be very clear about this. Right now in this country, we do not have enough ventilators to meet our needs. We do not have enough masks and respirators and goggles to meet our needs. In the state of Rhode Island, we do not have enough hospital beds. That's a fact. That's a brutal fact. It's a fact. So what that means is I need to buy us some time. We together need to buy some time. We need to buy a little time to ready the system. More testing, more beds, more ventilators, more doctors. Only one way to buy us time. Every single person out there, staying at home, minimizing your contact with other people, washing your hands for 30 seconds constantly, washing your surfaces. This podium is sanitized before I come out here, after I leave, and several times through the day. So I'm going to keep saying it because mitigation depends on you. And for those of you who are doing it, thank you. A little bit of good news. I want to start by acknowledging that last night President Trump approved a disaster declaration for Rhode Island. You may wonder, why is it good news that we have a national disaster declaration? Because it means that the federal government and FEMA will be reimbursing the state of Rhode Island, cities and towns, and school districts for many of our expenses. They will be reimbursing us for expenses that we started to incur as a result of coronavirus starting on January 20th. So these are expenses for cleaning, personal protective equipment, and other expenses that we're all incurring in order to meet the challenge of the virus. I would like to thank our federal delegation, Senators Reid and Whitehouse, Congressman Langevin and Cicilline, who've worked hand in glove with me for the past few weeks to secure this. I especially want to thank my director of the EMA, Mark Pappas, and General Callahan for your incredible work working with me and my team to make this happen. It's a great thing for Rhode Island. It'll give us the resources that we need to fight the virus and to fight the crisis. I mentioned the other day that the most common question I'm getting right now, I'm getting two questions frequently. One is, how long is this going to last? But even more than that, the question is, how can I help? What can I do? How can I help? On Sunday, I asked you to do one nice thing for somebody. I also asked you to write down the list of 5 people who you're going to be in contact with. And I really want you to do it. Write down the 5 people you'll constrain yourself to being near. Today, I have another really important assignment for everybody. I want you to write down at the end of every day where you've been and who you've been in contact with physically, not virtually. So hopefully that's an easy assignment, because the answer will be I've been at home and I've only been in touch with my family. But I want everybody at the end of the day to write down all the places you've been and all the people you've been in contact with. I'm going to do this, and I'm asking you to do this. Because in the event that you get sick, and we hope that you don't, but many people will, it'll help us enormously to do the contact tracing. And when you start to feel symptoms, we're going to have to do the contact tracing of every place you've been and everyone you've been in touch with for several days prior to that. So help us out and keep everyone safe. At the end of every night, write down where you've been and who you've had contact with. Keep a log, and hopefully you won't need it, but if you do, you'll be glad you had it. Next, I have an announcement, like most of these announcements, that I had hoped to avoid, but unfortunately I cannot. As of this Friday, April 3rd, state beaches and parks in Rhode Island will be closed. I wish I didn't have to do it, but this past weekend, Colt State Park, Goddard Park, Lincoln Woods, the public beaches were packed. They were packed with people closely congregated, and that has to end. It should have already ended. It has to end. So we will be closing all the public parks and beaches. It doesn't mean you can't go for a walk. It means they are closed. You can't park your car there. You can't congregate there until further notice. And I know that's going to be hard because we're all super cooped up and anxious to get out. You can still go for a walk. You can still use the bike paths. You can still, as I said, maybe go for a walk on the beach if you're close enough to be able to walk there. But you cannot park in the parking lots, and you cannot do this in big groups. I don't know why people are still doing that. I honestly don't understand why you'd still be doing that. You're risking your life, your neighbors' lives, and hurting Rhode Island. So stop it, but also know that as of April 3rd, we are officially closing parks and beaches. This is typically the time that we are opening campgrounds. They usually start to open in mid-April. We are postponing all campground openings until at least May 1st. I want to make a note about businesses, particularly small businesses. I know it's brutal. If you're a small business, you're getting crushed, and I'm sorry. There's no other option, and I promise you I'm going to get you back up and running as absolutely soon as possible. Having said that, right now, it's difficult, and I would like to make an announcement about a piece of relief for you. Today, starting today, the Rhode Island Superior Court is rolling out a new program to assist businesses whose businesses have been significantly disrupted by the virus. Normally, if you're a business and you can't pay your bills, your business is sold or unwound, and obviously your assets are divided among your creditors. We're trying something new, and I'd like to thank the Superior Court. They're putting up a new initiative to enable attorneys and accountants to work with business owners so that they can continue to operate, access capital, such as disaster assistance, and pay their debts incrementally under court supervision. So this new initiative, which you can learn more about on the Rhode Island Court's website, which is courts.ri.gov, is an attempt to help businesses work it out. Work it out, get some leniency, and maybe put yourselves on a payment plan. And I want to thank the courts for getting in there and supervising this. And I'm asking you to save every small business that you can, and to just at least help tide them over until we can get to the other side of this. Testing, as I said, we have a goal by the end of this week to be doing 1,000 tests a day. We are well on our way to achieving that goal. We're not there yet. We're at about 500 or 600 tests a day now, but I believe by the end of the week we'll be at 1,000. I mentioned yesterday that we have large drive-through testing sites staffed by the National Guard at URI, CCRI, and Rhode Island College. All of these sites will be fully up and running by tomorrow. Some are up and running now, but they'll be all fully operational by tomorrow, staffed by the National Guard. Two things I want to mention about this. Number one, expect lines. We're going to do our best to get you in and out quickly. They are drive-through clinics. There's a backlog of tests right now. It's taken us a little while, like every state, to get our testing up and running, so expect lines. We'll do the very best we can to get you in and out as quickly as we can. Secondly, do not show up without an appointment. These are not, they're drive-through clinics, but they're not drive-through clinics. You can't just drive up and be tested. The way to get an appointment to be tested is to call your primary care provider. We have worked incredibly hard with the primary care providers in Rhode Island, and I want to thank the primary care providers for their patience and collaboration. We've worked very hard with them so that you can call your doctor. They'll tell you if they think you need a test, and then you can get an appointment at one of these drive-through sites for a test. Please note that you may not get your test result for a few days. Hopefully it's 1 or 2 days. It could be 3 or 4 days. Why is that? We are prioritizing tests for healthcare workers, folks who are hospitalized, and the critically ill. That's necessary. Those folks have to be tested and get their test results back within a day, or as close to that as possible. We're working that. So they're going through one channel. For all the rest of us, we're going through another channel, and we are relying in part on commercial labs. So it could take a day, 2, 3, 4 days. That's going to decrease over time. I expect a week from now, that'll be a quicker turnaround than it is now. But I don't want you to be alarmed. And the truth of it is, you're going to be told to do the same thing anyway, which is to stay at home, unless if you get very sick, and then you'll probably have to go to the ER or the hospital. So please be patient and don't be alarmed if you don't get your results back for a few days. It's April 1st tomorrow. Lots of the end of the month, beginning of the new month, we're getting lots of questions about utilities and evictions. So I want to take a second to remind people that the courts have delayed all non-essential business through April 17th. That means you cannot be evicted between now and April 17th. So if you're a landlord, listen to me. You are not evicting anyone until April 17th. And after that, I'll be back with further announcements because we don't want you evicting anyone after April 17th either. If you're a renter and you're stressed out and you can't pay rent and you've lost your job and you get an eviction notice, ignore it. The courts aren't open. It won't be adjudicated until April 17th. I'll be back by the end of this week or early next week with longer-term announcements around evictions. Same thing around regulated utilities. Electric, gas, water, and sewer will not be shut off, even if you can't pay the bill, until at least April 15th. And same thing, I'll be back with more guidance on that. Now, as I've said so many times, do the right thing. If you can pay your bills, pay them. If you can pay your rent, pay them. Frankly, if you can pay your taxes, pay them. You know, landlords have a business to run, the state has to keep the lights on, water, gas, utilities. So if you're lucky enough to be in a position that you can pay your bills, pay your taxes, and pay your rent, do the right thing and pay it. But if you're like the many tens of thousands of Rhode Islanders who are barely getting by right now, don't stress. No one's going to shut the lights off or kick you out of your apartment or your house. Last week, I said that I needed volunteers, and hundreds of you responded. I want to make another pitch. We are in desperate need of trained medical and behavioral health professionals who are not at this time working full-time. I'm asking a lot. We need you. We can't get through this crisis without you. We will run out of people. Doctors, nurses, CNEs, physician assistants, therapists, social workers. If you're out there, if you're retired, if you're only working part-time, if you have some extra time on your hands because your practice has changed, I'm calling you up. I'm asking you, please, to respond. I've called up the National Guards. I've called up so many volunteers. I'm calling on manufacturers in Rhode Island, and I'm calling on you. I did it last week, and within a day, 400 people signed up. I want to see, please, another 400 in the next 2 days. Go to riresponds.org, riresponds.org. Last note, we've been at this a long time. We've been at it for a month, and everyone I know is having a combination of feelings: overwhelmed, scared, anxious, going crazy, generally, being stuck in their house, frustrated, and everybody wants to know, when's it going to end? So this is my best advice for you. Take it a day at a time. Try to get through today. Reach out to us if you need help. Do everything you can to do something kind for a neighbor or a friend or a family member. And know that, even though I don't know how long this is going to last, know that every day we're going to get a little bit better at responding to the crisis. So very, very soon, I hope to have announcements around better food delivery for folks that are in quarantine, better access to mental health for kids and for adults who just need somebody to talk to, better ways to track your better ways to track your symptoms, more, faster, and better testing. There's one thing I know is that we're going to get to the other side of this. I don't know exactly when, and it won't be forever. And I do know that Rhode Island is in better shape than a lot of places. And I also know that panic and meanness isn't going to help at all. So if you have it in you to check in on a loved one or a neighbor or even a stranger through social media or a text or to call them, please do it. And if you're feeling totally overwhelmed, call BH Link, call Kids Link. If you're a business, call 521-HELP. And just know that every day we get a little stronger and a little better at meeting your needs. And I hope that in a week or 2 weeks or 3 weeks, even though the virus will be much more widespread and there'll be many, many more cases, our system will be that much better to deal with it. So now I'm going to turn it over to Dr. Nicole Alexander-Scott, and then we'll come back for questions.
Thank you, Governor. Good afternoon. As the Governor said, we have 86 new cases of COVID-19 in Rhode Island. This brings our case count to 488. As I've said also on previous days, we're doing our best to report the most up-to-date numbers possible. This means that the numbers I'm sharing at these briefings are provisional. 6 of the cases from yesterday have been transferred out to other states, That is why we have 86 new cases for a total of 488 cases, despite the number that was reported yesterday. We know that this will continue to evolve, and we will work to keep you up to date on the information as we have it. As the governor also mentioned, sadly, we have 4 additional fatalities. This brings our total in Rhode Island of people who have died with COVID-associated disease is 8. One of these individuals was a male in his 60s, and one person was a female in her 80s. The 2 other people were a male and female, both in their 70s. Our deepest sympathies are with these families. To talk more about testing for a moment, I want to provide some more background to what the governor was discussing. To date, our testing has largely been focused on healthcare workers, hospitalized patients, and people who live in congregate settings, such as nursing homes. Those are our priority, most vulnerable groups that we need to address first and foremost. That will continue, primarily through the state health laboratories that has continued to expand to respond to those needs. With these new sites set up, we are going to start testing more people who are symptomatic and have a variety of components connected to them. People who have symptoms and are older than 65, people who are patients with underlying medical conditions and have symptoms, and people who have symptoms and are critical infrastructure workers, such as police officers and firefighters. These are whom we are expanding the testing to start, and we look to very quickly open it up even further to anyone with symptoms, even if they are mild symptoms. The key is working through a healthcare provider. We are working directly with healthcare providers to ensure that they know how testing should happen based on these groups and as we take these steps quickly. I'll reiterate that this process starts with healthcare providers. If you have symptoms of illness, please stay home. That's key first and foremost. Then you should pick up the phone and call your healthcare provider. Do not show up at any healthcare facility, whether it's an office or a building. It's important to call in advance. If you think you need medical care and have symptoms, particularly from one of the groups that I mentioned, you have symptoms and you're 65, you have symptoms and you have underlying medical conditions, or you have symptoms and you are a critical infrastructure worker, you should definitely call your healthcare provider, and they will walk you through the steps that we have shared with them, working very closely with healthcare providers. If you don't have a healthcare provider, you can call an urgent care center near you. Community health centers are also an option. Urgent care centers have been setting up respiratory clinics to specifically see people who have symptoms of illness that we want to address and get you directed to testing. Based on your symptoms and based on the updated guidance we are providing to healthcare providers, all providers are directing people to the places to be tested that have been set up. That's why it is key that no one just shows up at any of the drive-through testing sites, and no one just shows up at a healthcare provider or an emergency department or other healthcare facilities. The key is to be able to call in advance, and going through a healthcare provider is the best way to facilitate this process so that there's someone you can work directly with to get your test results and determine next steps based on that. As the governor said, no one should be going directly to any one of the remote specimen collection sites. We are taking this approach to testing to test and protect our more vulnerable populations and then quickly begin to expand out to anyone who has symptoms. And we're taking this approach to testing because it is imperative that our critical infrastructure workforce stays healthy. And they have the ability to support us as a state throughout this response. So that's why we want to make sure our police, our firefighters, our first responders all have access to what's needed. One other measure we are now taking to maintain our critical infrastructure workforce is allowing nursing students who have completed one semester to get a 90-day certified nursing assistance license so that they can accelerate joining the workforce that we want to build out and have preparation for, both in our healthcare facilities as well as in our nursing homes. And there will be updated steps that we will share to talk about how you can take advantage of joining the workforce to be able to assist. We are sending guidance out to nursing schools today so that they can get information to their students about how to start this process so that any nursing student who's completed at least one semester can accelerate to get a 90-day certified nursing assistance license. This also gives me an opportunity to share the updated guidance that we are providing to all healthcare facilities regarding masking. Surgical masks are helpful for the person wearing the mask to prevent them from having symptoms that spread to the person that they are exposed to. Surgical masks do not prevent the person wearing the mask from getting exposed to someone else who has symptoms. Because healthcare workers are a critical part to our infrastructure, and because healthcare workers are often caring for very vulnerable populations, whether in a hospital or in a nursing home setting, starting today, we want all healthcare workers to start wearing surgical masks. We have started to see that there are times when someone may not feel as they have symptoms, which is critical. We want to continue the screening to make sure no healthcare worker steps into any facility with any symptoms. But there are times when someone may be early on and not realize they have symptoms, or may even have symptoms that develop during the course of a day that they've gone in. That is why we are issuing this guidance to require all healthcare workers in healthcare facilities to wear surgical masks. I also want to reiterate what I was saying yesterday about the importance of environmental cleaning every 4 hours in nursing homes and other congregate living settings, as well as in healthcare settings. That means using EPA-registered hospital-grade disinfectants to clean high-touch surfaces, as well as to clean shared resident care equipment. As the governor mentioned, this podium, countertops, sink tops, doorknobs, those are all of the places that we want cleaning services to focus on a regular basis. We have started to see that this virus can be transmitted by droplet to surfaces where it can remain for some time unless appropriate cleaning is done to remove it. That is a significant way that viral transmission can occur. So we want all healthcare facilities, all critical infrastructure places as well to know about the importance of cleaning consistently every 4 hours if possible high-touch surface areas, doorknobs, countertops, sinks, anything that you know the public is touching on a regular basis. That's for our municipalities, firefighters, police, EMS, nursing homes, hospitals, the critical workplaces that have remained open all need to make sure that they are applying this environmental cleaning regimen effectively every single day. I want to make one last note. As the governor said, tomorrow is the first of the month, and I know this is a day when a lot of people go grocery shopping, including people who are recipients of food assistance. Number one, do not go to the grocery if you feel sick, even if you feel a little off. Do not leave the house. We will continue to work hard to expand the food delivery services so that fewer and fewer people actually need to leave the house. But if you are going to go to the grocery store, I want to tell you a few things to help you keep as safe as possible. Number one, please limit who goes. You don't need a big group going from one household. Choose one person to go to the grocery store for all of the people in those households. Number two, think about whether or not you can help someone else avoid a trip to the grocery store and combine it with that one trip that you are doing. We talked yesterday about thinking about seniors who are living home alone, those with disabilities who are living home alone. Check with your neighbors, check with your loved ones, check with your friends, and coordinate one grocery store visit for as many people as you can to limit the number of people who are going out. Then once you are out, keep a distance of at least 6 feet from other people at all times, whenever possible. To grocery store managers who we are working closely with, be aware of the guidance the governor issued last week about grocery stores allowing no more than 20% of stated fire capacity. And within stores, do what you can to ensure and enforce that people are standing at least 6 feet apart. This is the moment that we need everyone doing your part. Take care of yourself, stay home, take care of your neighbors and your loved ones. Each day that you are able to follow these critical rules, each day you can do better to protect yourselves, to protect your loved ones, and to protect Rhode Islanders. So with that, I'm going to give it back to the governor so we can get started with questions. Thank you.
Good afternoon.
Good afternoon.
And to folks at home, we just wanted to remind people that I'm reading questions that reporters from all over southern New England are submitting here on a monitor in real time. So we wanted to begin with this question today. What is being done by the state to help homeless advocates who are trying to reduce the density in the congregate shelters, especially Harrington Hall, Crossroads Women's Shelter, Emanuel House, and the Rescue Mission?
Yeah. So my administration is working very closely with all of those advocates. In addition, we are in the process of procuring or leasing several hotels where we will be able to quarantine folks who are homeless so they can be there safely. But I would like to give Brett Smiley, my Director of Administration, a minute because we have a lot going on in that area.
Thank you, Governor. As the Governor and Dr. Alexander Scott have talked about a few times, this virus seems to be impacting those most vulnerable especially hard. That's no more true than anything with the Rhode Islanders experiencing homelessness. And so we have had a team in place for some time, and as the Governor referenced, we do now have, in fact, emergency shelter situations available for those experiencing homelessness who need to be quarantined or isolated. Those structures are in place. The next step is for us to work on de-densifying the congregate settings, and we're working closely with advocates and are making progress along those lines. And finally, as we all do our best to meet the needs, this is a good time to thank and remind Rhode Islanders that the joint effort between the Rhode Island Foundation and the United Way to marshal both philanthropic and corporate support to bolster the social safety net is really helping fill those gaps. And so we want to thank the Rhode Island Foundation and the United Way, but also ask all Rhode Islanders, corporate charities, and other philanthropists who might be able to chip in. Government is doing its best to meet these needs, and we will continue to make progress with the homeless advocates, but there's a role for private sector social service agencies to play as well. And so we appreciate any additional contributions and support that you can give them at this critical time.
A state-by-state study by the University of Washington shows Rhode Island will see a peak in hospitalizations on April 19th and as many as 259 deaths by August. And the question is, does Rhode Island's modeling reflect the same trends?
So we are very familiar with that model. In fact, we are in touch with the University of Washington. Our model looks a little different. Our model would suggest that the peak is further out, but also higher. Having said that, we're still working the model. None of these models are precise enough. At this point, we still have limited numbers, 8 deaths, 59 people in the hospital. We're reaching out to Brown University, Johns Hopkins, our own top-notch epidemiologists at the Department of Health. So I would say that model is directionally correct insofar as those numbers are probably in the ballpark, but we're still refining our model to reflect the actual experience that we have here, and we're probably at least a few days or a week away. Again, we just need more data to populate our model. I will say this, the entire model depends on the level of effectiveness of our mitigation. So if you get under the covers of the model, like any model, it's all dependent on assumptions. The biggest assumption is the rate of compliance with social distancing. So if we are very good at our social distancing, if people are staying at home, washing their hands, limiting your contact to 5 people, the model will look very different. Slower peak, lower peak, fewer hospitalizations. If we keep pushing the limits, then it's going to be worse and higher and sooner.
Governor, the mayors of Pawtucket and Central Fall want Memorial Hospital to reopen to help with the crisis. How realistic is this, even if CARE New England agrees?
Those mayors know, as we are in touch with the mayors every single day, and they are free to make those comments on these phone calls. Public statements like that on the basis of limited information aren't very helpful right now. The Army Corps of Engineers has been on the ground working around the clock for over a week with General Callahan and his troops. That is in the mix. Memorial Hospital would be incredibly expensive to reopen. Are we looking at it? Yes. Are we looking at another 15 to 20 alternatives? Yes. So as these mayors know from our daily calls, we are looking at that. We're looking at the convention center. We're looking at everything. You can assume every hotel, abandoned building, former hospital, convention center, large hall, formerly occupied business building. We have engineers, architects, and the Army Corps all over it trying to make a statewide plan to meet the needs of COVID.
Next question asks, with the General Assembly unable to meet, decisions are being made by the senior leadership from the Democratic majority. Would you be willing to bring the senior leadership from the Republican minority into the process to ensure fair representation?
Yeah. So, as the governor, I have never, nor will I begin now, to tell the legislature how to do their business. I don't know of any decisions that are being made by legislative leaders. As I said yesterday, they've been very supportive. Speaker and Senate President have both assured me that they're there to support me and our team in this effort. There's no need at this moment for any legislation. When the time comes, and I don't know when that will be, then I'll call the legislature back into session and we'll figure out what to do. In the meantime, I'm asking all legislators to do what you're doing. Stay home, stay in touch with your constituents, and do your very best to get the word out to your constituents and also to get the word back to us. I need to know what your constituents are thinking, needing, worrying about so that we can together respond. I, of course, am happy to take any phone call, anytime from any legislator and would welcome any of them to call if there's anything we can do collaboratively or to be helpful.
Governor, we've been hearing from a lot of people who have joint custody of their children. What's your advice to people who have co-parents that live either in Rhode Island or out of state?
Thank you for that. So this is a important decision to make. Our key with addressing the spread of this virus is to limit the number of interactions that are occurring with different people. As I spoke of earlier, we know that the virus can land on surfaces in the public that have frequent touching of members of the public. Because of that, whenever possible, it is most helpful to stay at home. If there are creative ways that co-parenting can occur with video, teleconferencing, calling more frequently by phone, that allows you to be able to stay at home and stay safe while still doing the co-parenting that's needed, it's something that we strongly recommend.
Next question is about groceries. We're hearing and seeing reports of food shortages in the grocery stores. What can you report about the supply of staples entering Rhode Island this week?
Yeah, so we've been in touch very regularly with the grocers, both the local grocery stores, locally run and operated, as well as the national chains. They continue to report that they are receiving supplies. Obviously, this is an extraordinary time, so you're not going to be able to get everything you want, precisely what you want, when you want it. But still, there's no need for hoarding. There is need for some patience. But from everything that I know, and we're tracking it, food supplies are coming, interstate commerce is happening, the trucks are coming, shelves will be refilled. Be a little bit patient, but don't worry. Don't worry. The food and supplies are coming.
Are you aware of any plans that the U.S. Department of State is organizing flights from the Dominican Republic to bring U.S. citizens back home to Rhode Island? Where can they get more information about this?
I am not aware of that, so I see that it's Tony from Podair, and we'll get back to you.
Next question, we're hearing about guidance models. Oh, excuse me. The mayors of Pawtucket and Central Falls. Oh, we've already had this question as well. What can you tell us about the hospitalized patients, their ages, the number intubated, and do they have pre-existing conditions?
So for the hospitalized patients, we said that we have 59 of them. We do have about 14 who are in ICUs, and 9 of them are intubated. The ages range. I think it's an important message to be able to let people know that this virus is impacting people across the spectrum. We know for sure that the numbers are more concerning in terms of the outcomes in our older population, but those with underlying illness can range from 30s and up. And then there are occasional times when we are seeing younger, healthy folks also get admitted to the hospital. So the more everyone can abide by the community mitigation rules we are saying, it is true when we say it's not only for your benefit and for your loved ones, but it is also for all Rhode Islanders. You can start to look around in neighboring states where there are more cases that are occurring and more hospitalized cases. It is impacting folks across the age, and the unfortunate deaths are occurring at varying ages. So we need particularly our young adults to understand how serious this is. Thank you.
You may want to stay for this next question. Massachusetts is seeing a dramatic increase in deaths and quarantines in several nursing homes. Knowing that the coronavirus does not know state lines, please provide detailed information for what the status and protocols are at Rhode Island nursing homes, particularly the Veterans Home and Oak Hill Nursing Center.
This is critical because this is where our most vulnerable community is. We have been having conversations with folks nationally, in Washington, in DC, and others to make sure we learn and cull all the information we can to help protect our nursing home community. With all of that being done, there can still be challenges as we're seeing across the country. We currently have in Rhode Island 3 nursing homes where deaths have unfortunately occurred. 2 were at Golden Crest, and 1 was at Oak Hill. The 4th fatality was not a nursing home resident. We are also seeing nursing homes where there are groups of cases that are occurring. That is both at Golden Crest Nursing Center and Oak Hill Health and Rehabilitation. At another facility, we've seen 1 isolated case We will only be reporting names of nursing homes if we are seeing groups of cases that we are responding to help balance the release of information that's needed and the confidentiality. This is consistent with the policy that we've taken with information about schools, organizations, and other facilities that have groupings of cases occurring. I want to ensure that we are being as aggressive as we can be with handling these nursing home cases. I want to also credit our nursing home community. They have been active, they have been engaged, they have been dialoguing with us on a regular basis and looking to see all the things that are needed to help protect their community, including their residents and their staff. And as I shared earlier, with the step that we're doing with having nursing students be able to have a temporary certified nursing assistant's license, we will continue to provide updated guidance on the steps that we're taking to make it so that we can maintain the capacity needed in our nursing home settings as well as in our healthcare facility settings. I'll also reiterate the aggressive approach that we are taking with surgical masks. We want, and many have already started doing this, we're just making it clear it's across the board. Every healthcare facility, hospital, and nursing home to have all of their healthcare workers wear a surgical face mask to protect themselves from having symptoms that they are unaware of be transmitted to patients in this vulnerable population. Anyone who has symptoms that they know of should not be reporting to work, period.
Next question is for the governor. Back to kids and school. What is the plan for children in special education classes? Has the 10-day period expired?
We are providing education remotely and virtually to all children, including those with special education needs. And I believe the answer is yes, that the 10-day period has expired. I can check on that and get back to Tara. As I said yesterday, the challenges with certain populations, kids with IEPs, English language learners, kids with special needs, are definitely greater. We are making progress, and it's a top priority of Rhode. Overall, I've been pleased with the efforts, and again, I think a week from now and 2 weeks from now, as we continue to innovate and learn, we're going to get better and better.
Why has Massachusetts seen a much more significant increase in testing compared to Rhode Island?
They haven't actually. They're testing about 3,500 people a day. We're testing about 500 to 600 people a day. So on a per capita basis, it's very similar. And as I said, I hope that by the end of this week, we'll be closer to 1,000. It's a struggle everywhere. It is a struggle everywhere, and we're doing the best we can. As I've said many times, it's just a complicated process. Not only do you need the machines, you need the swabs, you need the testing kits, you need the reagents, and you need all of them in the right quantity at the same time. And to get that, I'm going to fight on our own with everyone else in the world trying to get these same ingredients. So we're roughly in line with where Massachusetts is, and I am hopeful. I began my day with a briefing call on testing. We started just yesterday. Primary care providers can order tests. Tomorrow we'll be up and running with the drive-through testing, so I'm confident that in the next few days we'll be much, much better than we are today.
And for our last question today, just to continue this thought, you said on Monday that more tests will allow you to better plan the state's response. Can you elaborate on that?
Yes, so where we want to drive this, as right now we're in clearly crisis mode, and we've taken a blunt approach, shut down all restaurants, all businesses, etc. Where you want to drive that's not sustainable. We have a 10-15% unemployment rate right now. I cannot let that exist for one day more than necessary. So where we need to drive this is an ability to have widely available testing so that anybody who needs a test could be tested regularly, get their results the very next day, and then if they're positive, they are isolated, and we do quick contact tracing. When we get to that kind of an approach, which is similar to what they have in Singapore and South Korea, then you can get into the business of reopening the economy. But until we have an ability to pinpoint either by the person and then get them into isolation and all the people around them, or by the neighborhood or geography or home, it's just too dangerous. So the goal is really crank up the testing. I'd like to move us to kind of a digital, electronic way of doing symptom tracking and contact tracing. Once that's in place, then we can reopen the economy in a new way with new regulations, confident that we can quickly pinpoint who's sick and get them effectively into isolation.
Thank you, Governor.
Bye. Thank you.
Stay well.
Yeah, you too. Thanks for your help.